Good evening, everybody. Welcome. And thank you so much for joining us with CEO and founder of the Afya Foundation, Danielle Butin. I'm Jessie Sullivan. I'm the communications manager at Afya. I've been at Afya for about a year now. And I'm happy to have you here tonight to guide our conversation with Danielle. So just a quick overview of where the conversation is going to go tonight. First, we're going to discuss the coronavirus. It's the #1 threat in our community. It's what we're all thinking and talking about right now. So let's get the facts straight. We're going to talk about it. Then we're going to lean into learning about what Afya has been doing this year in response to COVID-19. And finally, we'll close with our plans for the next few months. And then at the end, there will be plenty of time for questions and answers. So if you have some questions, I'll discuss how we're going to do that later on. So everybody, welcome Danielle.
A warm and welcoming hello to all, and thank you for being here with us.
Yes, thank you. So I'll just jump in. My first question relates to COVID. We're seeing a spike in cases around the country. Can you talk more about this?
So I'm going to open by being frank, because I believe that once people know the truth, we can each be empowered to make decisions, act, and change what we actually can. The current rate of infection and hospitalization is higher than we saw last spring. Numbers are rising in every state in our nation. And in just 14 days, the number of cases has climbed to 81%. For those of us in the public health sector, these findings are staggering. You've heard these statistics, and I imagine that reports of the disproportionate impact of COVID on minorities. Across the US, Black and Latino populations have been 3 times as likely to contract the disease and twice as likely to die. Native Americans have also been disproportionately impacted. And this is because of many factors: multi-generational dwelling, the inability to access healthcare, the quality of healthcare, generational impact of incarceration, and systemic poverty are all to blame. And I'm going to return to this later, but this has been and will continue to be one of our major areas of focus: the care of the underserved and the often unseen populations.
Yeah, wow, those are some really staggering, frightening statistics. So where are you looking to right now? Where are these cases, and where's your primary concern?
So while we are all hearing on the news about the Midwest and the Northwest being hit incredibly hard, stories are coming out of North Dakota that they are at 100% capacity, and they are asking asymptomatic nurses to work and care for COVID patients. It is truly getting worse everywhere daily. And without federal direction or guidelines, doctors and nurses, our frontline, are begging people to stay home, socially distance, and wear masks. Some legislators and leaders are imposing far tighter restrictions and are finally mandating masks, but there are a lot of people still choosing to exercise their personal freedom, make a statement, and deny risk. And as a result, they become the silent spreaders and will tragically change the complexion and the stories of families they will never know. On top of this, sourcing is now a serious problem, and this includes staffing and PPE. Back in March, doctors and nurses from other states came to our rescue. They flew into New York to help us. Today, they are helping their local community to survive at home. In addition, the strategic national stockpile and overall access to PPE is heading towards the same situation we were in last spring. Only now the volume of need is everywhere. It has escalated again. And with an increase of volume of patients being seen and testing positive comes the need for more PPE on many front lines to reduce the incidence of spread at all levels of care providers. And this is where Afya comes in. We know how to get the supplies to people who need it right into their hands. So that's what we're going to be doing.
Yeah, wow. All right, well, I wanted to welcome, we have a bunch new people signing in. Thank you everybody so much for joining. Danielle, Can you tell us what COVID is looking like in our own community?
Of course. Um, so Westchester County has about a 4.6 positivity rate. And what that means is that folks who are working essentially are going to be impacted by this. Now they are looking at 25% of capacity of folks working in a workplace, and that's going to impact Afya. The beauty here is that we are very good at innovative problem solving, and we are already doing that and coming up with solutions for how we can respond to a greater need with creative staffing models and support across a number of different warehouses spacing. Mount Vernon in our backyard has a stay-at-home advisory, and now New York City is at a 2.8% rate. And the problem here is there's no stability or standardization of processes. Some schools are staying open, some are going to be closed, new restrictions on non-essentials in restaurants. But the problem is that there is no steady message across our country that people can enforce, and state to state infection is going to become a significant problem with a lack of standardization.
Yeah, that is very, very worrisome. And clearly, there's a huge need at home. So I understand that we'll be helping people in our own backyard, but Afya's mission has always been to serve those across the nation and internationally. Can you tell us about some other sites that are on the radar?
Of course. So in addition to New York, we are very, very concerned about two sites in particular, and they are Navajo Nation and Puerto Rico. Navajo Nation is a sovereign nation, and they have just surpassed 13,000 cases. This is 8% of their population. And this finding has enormous implications for the future, I think, of their community. They had the highest per capita infection rate back in May and are once again in the throes of this spread. And what makes it even worse is they are historically cared for by a barely functioning, poorly sourced healthcare system. New restrictions were just imposed. There are stay-at-home orders now for the next 3 weeks. But the problem here again is that while New Mexico is putting in similar restrictions, neighboring states around Navajo Nation are not. It's further evidence why we really desperately need a national plan. And then we turn our sights simultaneously to Puerto Rico and our amazing partners there who we have worked with since Hurricane Maria. And I am also concerned there. They have an 8.3 positivity rate. These rates in Navajo Nation and Puerto Rico are far too high. And the interesting compilation of Puerto Rico is that combine this high rate of transmission with limited PPE, the fact that they are trying to access supplies from an island, and following Hurricane Maria, so many healthcare providers fled. It was an exodus from Puerto Rico to the mainland. So now you have far less staff on the island to care for patients. They have not received the federal support they were promised, and they pose a tremendous risk right now for their ability to manage.
Yeah, it's kind of bleak, especially after the earthquake swarm that was happening in Puerto Rico also in January and February. Their infrastructure is seriously damaged. So this has been a lot of bad news. Can you tell me a little bit about how Afya is helping and maybe bring us into some good news?
So we're doing some amazing work and we want to do more of it. That's the good news is there's a long tradition in the world of trauma work where the secret of getting through a time that is unimaginable is to act. So I share that with everyone on this call, is to find ways to act. We would love you to walk into Afya more and bring people with you to act with us. And so what are we doing? We are listening very closely to the expressed needs of our agencies who we are working with. And after we listen to them, we act and deliver as much as we possibly can quickly. We are focusing on the community organizations and the federally qualified health centers because they typically don't have access to these supplies. They don't have, some of the organizations we're helping do not have supportive boards that can financially purchase these items. The federally qualified health centers, some of them have said they would have had to close if Afya wasn't showing up and providing them with support. We are helping the underdogs of our community so they can support the most vulnerable. Some examples of our partners at this point include the Harlem United Federally Qualified Health Center, the New York City Homeless Shelter Coalition, Adopt a Native Elder in Arizona. These are personal shipments that we put together that they are in active dialogue and conversation with us around what they need. And we are nimble and responsive, and we can react to what it is that they're asking us for. A beautiful recent example is just this week, we received 200 pallets of blankets and duvets. And I always talk about this magic of Afya, that when a supply appears, the need is just breaths behind it. And we received this offer, and then that, I'd say a day later, we started receiving emails and requests from homeless shelters. With the increase in COVID comes a concurrent rise in homelessness, unfortunately. We're seeing it in New York City, we're seeing it in Westchester County. So these blankets are now going to become the solution for some of these homeless shelters. Concurrent to that, FEMA today just sent us 1,000+ boxes of masks that we are going to deliver to the homeless shelters for the staff so that they are covered and the people they care for are warm at night. So this is where Afya's ability to be nimble and creative really comes to life, I think, in a profound and deep way. And the key here is that the folks that we are going to be helping would not have help if we weren't coming. It's one thing to say that we get it somewhere else, but for so many of the organizations we're working with now and supporting, they have flat out said to us, if you weren't helping us, we wouldn't have these supplies. We wouldn't have what we need because you're paying attention to us. We're actually going to have a possibility of help here. And I think that's a really significant piece of where Afya's radar is going to go in the next few months. And we can't do this without our supporters, without everyone on this call and this enormous, beautiful, supportive Afya family. You make it possible for us to say yes to supplies being offered, to bring them into our warehouse, to sort carefully, to streamline our process, and distribute as fast as we possibly can.
Wow. Yeah, so Afya is able to work with local organizations and really listen to their needs. I think that's the biggest takeaway from everything you've just said. And it's really unique and special. Are there any accomplishments from this past year that you'd like to share?
So we did an amazing set of deliveries in the past year, and I think people's lives are far better because of it. So we were able to deliver 2.3 million masks to partners in just a matter of months. We had 420 shipments going out since the beginning of 2020, and 4.2 million pieces of PPE were actually delivered to our partners. And I can't emphasize this enough. What we do that is so unique and different, there are a number of things we do, but one of them is that we ask providers what they need and we show up and we put the supplies in their hands. We don't deliver to a hidden warehouse. If we're going to an ER, we go right to the ER and their staff comes out and takes the supplies. Federally qualified health centers, we have walked into exam rooms. Community agencies, we've been outside in their parking lot and said, come out and get your supplies. In many ways, it is beautifully messy, but we are committed to this process, and we are equally committed to not getting caught up in this red tape, rule-laden system that just simply puts people at risk.
Incredible. I mean, I get stuck on the 2.3 million masks. I honestly, it's amazing. And I've been here the whole time watching the number climb and climb and just getting ready for, oh, we're going to hit 1 million masks. We're going to hit 2 million masks.
It's amazing.
Think of how many healthcare workers whose faces we have covered to keep them safe and protected from COVID while they
So they
survive.
can go home to their families.
Yeah,
Exactly.
it's incredible. It's such an enormous accomplishment. So I'd really like to better understand these numbers and how Afya impacted New York specifically.
Okay. So back in the spring of 2020, when this all started, we really pivoted, wildly pivoted, and turned our attention to New York and the tri-state area. And since March, we've helped in our backyard 166 healthcare facilities, and of those, 80 are community agencies. And these are unique sites of care. So the agencies could include everything from homeless shelters to food pantries to volunteer ambulance corps. And I think what we went after was supporting people in the community serving very, very local needs. We have also helped the federally qualified health centers in our area. They needed everything from nasal cannulas to treat people with oxygen on site at the center, to canes and crutches so that people wouldn't fall and end up in an ER, to PPE. We recently helped a federally qualified health center in Staten Island open their dental program because we delivered enough face shields that dentistry could be opened again. Literally, they could not see any dental patients because they didn't have any face shields. So this is the level of capacity now that we are focusing and creating as an opportunity. We also helped schools while they were functioning at the beginning to open. And I think that was a significant contribution, especially in Harlem and in Yonkers. We donated to 8 schools thousands of pieces of PPE for faculty, for food service workers, for the cleaning staff, to keep them safe and as safe literally and emotionally as we could possibly keep them. And I think that we really just, this should support the view that we are a holistic approach. What people show up with a need for, Afya is highly committed to creatively finding a way to meet that need and to create the solution.
Yes, totally. Love it. I'm seeing a little question in the chat that I just can tick off really quick. Have we supported nursing homes with masks? Danielle? Yes. We have.
Oh yes. Oh my gosh, have we ever? We helped the CCLC nursing homes at part of Greater New York Hospital Association received a donation from Asia of 500,000 KN95 masks, and we helped distribute those to all the nursing homes in that network in New York.
Yes, elders are some of our
Yes.
focus population.
Yes.
We love serving the elderly people in our community and around the world. So I'll just pivot there. What about the rest of the country? Thank you for telling us about New York, but where else have we been?
Okay, so let's talk for a few moments about what we've done in Navajo Nation and what we have done in Puerto Rico, because those are recent and they're going to need to continue. So we are working in Navajo Nation with 5 different organizations. Core Respond, Sean Penn's team. We are working with the team from Hopkins, Adopt a Native Elder, a whole group of people out there. And we have sent 7 shipments of PPE and supplies to them so far. And I think one of the most beautiful things that we're doing is Core Response is building quarantine shelters in Navajo Nation. These tiny little shelters where a single elder can go because they're living in multi-generational dwellings. They are at high risk if someone tests positive in their home. So now they are going to live for however long necessary if a family is exposed in these shelters. There were no beds, there were no mattresses. Cuomo's office donated to us over 200 pallets, and included in that were hundreds of mattresses, thousands of pillows. So these items are now finding their way to Navajo Nation so that elders during quarantine can be protected. In addition to this, and these are like the story keepers and the keepers of culture. And before I launched Afya, I worked in aging. So this is near and dear to my soul in terms of this very specific work. We are working with them on ancillary supplies, and we are trying to find our way gently into the federally qualified health centers that are supporting them. Because if they have more medical supplies, then the wraparound of where they get care in an ongoing nature could change long term in Navajo Nation. We could use this as an opportunity to literally shift the way healthcare is available to people. And that's definitely something that we are going to be focusing on. In Puerto Rico, we've sent 2 shipments of PPE to our partner there, Acción Social, and they are going into people's homes and giving this to nurses and home visiting social service workers. They are spreading it. It is the most amazing thing I've ever seen. Literally, they will drive to staff homes all over the island and bring them PPE if they are in need. And we are sending our first shipment this week to Hatillo, a big federally qualified health center in Puerto Rico, to help their staff in that whole area be able to treat patients as well.
Wow. So I hear a lot of programs that are have been happening all year and are going to be continuing. So that's incredible to know that we are not just dropping and running, but we are in it for the long haul with a lot of these partners and making sure that vulnerable populations are covered from year to year.
So Jesse, let me just say one thing about that I think is important. Afya is not the organization that goes in during an acute need and then bails. So we, during COVID, we are seeing what needs to be done in Navajo Nation. It is opening up an entire perspective for us of where we could help them with areas around recovery and stay longer and make a contribution that's far more longstanding. We're doing that now in the Bahamas. We went into the Bahamas during an acute disaster, and now we are working with an amazing physician in Abaco on building a community health worker model, and we're sending containers of supplies so they can do home visits for folks on the island. The key is you walk in during an acute event, and then you have to find very quickly what is it that you have to contribute to the recovery of that land and its medical infrastructure.
Yeah. So once again, always listening to the people who we're serving and always taking into account their voice. It's
Yes.
really incredible. So I'd really love to start talking about what Afya's plan is for the future. We've had an incredible impact this past year, and I'd love to hear now, what is the plan moving forward?
Okay. So what I didn't mention was we played a very significant role in the consolidation and the shipment of supplies for Beirut. We sent 380 pallets following the explosion in August, and that was an enormous undertaking. COVID is everywhere in Beirut. So the needs were for literally medical equipment, medical supplies, PPE. We were helping to move medication. FedEx donated a cargo jet. Hospitals, major teaching institutions were in rubble. And so this was a big focus of ours over the past 2 months, I would say. Moving forward, we are building a disaster hub. A centralized hub of pre-positioned supplies that would help us respond, whether it's a pandemic, a war, natural disaster. We want to become the site where items can be collected, donated, people can turn to during times of need, and they can make a difference. And so we want to build this so that we can respond to the medical infrastructure of the land impacted and provide a centric spot for people in the US to be able to respond from New York. And I think that, look, Afya, I could talk about this forever, but I'm going to be, brevity is never my strong suit, but I'm going to try here. We have been doing this long before COVID. We are well schooled and successful in the process of assessing needs and responding quickly. I think we listen really well. This is not a sprint. This is going to be a slow run for months, if not a year. So we all need to find ways to act and to invest in the process of our nation's recovery through this and keeping people safe. And we need your support. We need everyone's support to help us continue during this crisis to listen, respond, build and get into the hands of people immediately what they need. And we have to help our front line, and we need your help for help our front line and the most vulnerable, because their stories, just like ours, deserve to follow. Thank you.
Yeah, thank you so much. It's such a powerful, powerful thing that Afya is able to do to get material that is so needed into the hands of people who have requested that material. So I'm going to open the floor up for questions now. So if you'd like to ask a question, you can go ahead and drop either just a question mark in the chat so that I know to call on you. We just want to have a little bit of order. People always talk over each other here. So do we have any questions from the audience? If you drop a question mark, I'll call on you. I'm seeing somebody called iPad has dropped a question mark. You can go ahead and unmute yourself and ask your question.
Sorry, that's me. Hi, it's Sam. I was just wondering, what can all of us who've just heard about the incredible work that Afya has been doing, what can we do to help? And how can we be supportive of Afya's work?
Thank you. I think that what we need right now is we need people to help us with funding. We are on the map, literally. I think FEMA is now donating to us. We are getting PPE. We are in need of adding more trucks to our fleet. We need more space. If we're going to serve this function for our community, we need help to raise more funds to make this a reality over the next number of months.
Yes, absolutely. And that is something that anybody, whether you have a lot of resources or just a little bit, anybody can help with funding. We accept every amount. So please check out our website. And it's just afyafoundation.org/donate. Okay, so it looks like the next person with a question is Michelle. And then Chuck will have a question after that.
Hi, Danielle. It's Michelle.
Hi, Michelle.
How are you?
I'm good. How are you?
So I remember at the beginning of this, the cost for PPE was through the roof.
Yep.
And that was eating up so much of the funds that you were receiving to be able to supply that. Has that changed at all, that dynamic?
I think people who were involved in spring 2020 know now who the snake oil salesmen are and how to avoid them. And that was no small feat to figure out who's legit, who's not. The attorney generals were investigating people. I think we have access now, if we need to purchase, to far better priced PPE than we did back in the spring.
Okay, thank you.
That's a great question. It was terrible.
Yeah. All right. It looks like Chuck has a question. Chuck?
So I'm excited about the new vaccines that are coming online, although I'm concerned that one of them you have to store at -30 and one of them at -70. And I was on a call yesterday with municipal officials from all over the country. And one of the things they said is, we need to find places to refrigerate this stuff and distribute it. Yes, it'll be going through CVS, et cetera, but there'll also be municipalities, will be distributed through churches and synagogues, et cetera. And who knows what the capacity of their commercial kitchens are. So I'm wondering if you have access to or have thought about places where you could get really cold storage.
That's such a great question, Chuck. We haven't, because we traditionally don't do meds, and vaccines are part of the medication supply chain. So we are set up for everything around it, but we are not. I mean, I remember a good example is I remember being in Africa years ago, and they had refrigerators of typhoid vaccine. I said, what are you doing with this in your refrigerator? Why aren't you vaccinating your community? They said, we don't have syringes or needles. So we can help with the ancillary products, but we can't, there are all of these mandates that we would have to do in order to be one of those distributors. So I think we're good at what we do, and getting into meds could become a whole different supply chain.
Keep on doing what you do. You're doing it well.
Thank you.
I was there today and I saw all those occupational therapists that you have with the interns, and they were packing and storing and they were moving and they were going quick, and it was very nice.
They're awesome. They're awesome.
Yeah, Great. Thank you so much for that clarification. I think it's important to know for everybody that we are donating medical supplies and equipment, and we have sources for that material. And when we have a need for that material and we need people to donate it, you can find that information on our website. And we do not currently accept used donations of bedding or clothing. That's not really our wheelhouse, but we do accept personal donations of wheelchairs or crutches or beds. And again, all that information you can find on our website. So thank you so much for everybody who's interested in donating material. And if you have some material you want to donate or you really want to be involved, I would super encourage you to go and donate financially. So I have a question here asking about how people can connect Afya with their company or with corporate social responsibility programs like that. Danielle, can you speak to that for 1 second?
Yes. So one of my, and Regeneron is our latest and really amazing partner who has come to Afya and is helping us with Westchester County, and we need more help because this is we're looking at months of need. And so another good example, I remember back in Maria, during Maria response, I was giving a talk at a synagogue in Scarsdale, and one of the congregants turned to me at the end and said, my boss has a private plane and I'm going to ask him. And he donated his plane for 4 trips to Puerto Rico and the US Virgin Islands. So I am saying this because one person can have enormous impact and influence. So if there are people in the CSR division or at the corporation that you would like us to know, please, please connect me, and then a member of our team will be back in touch with that person and with you. I can't emphasize enough, we do this work every single day. This is what Afya knows how to do. Now we just need more support to be able to do that much more of it.
Yes. All right, I think we have time for one more question. So if anybody has a final question that they want to ask, you can go ahead and ask it.
Sure, I have a question. This is Jake.
Great, thanks, Jake.
Danielle, I'd be curious to hear from you what you're hearing from hospitals and healthcare facilities right now in terms of COVID and do they have the materials they need and those types of things. What are you hearing?
That's a really good question. I think hospitals, I think this has gotten pretty bad quickly. Honestly, I'd say over the past few weeks, hospitals are starting to say, oh my gosh, like we're back in it. I think the major hospitals of New York braced themselves and many prepared and knew this was coming. The federally qualified health centers, actually, you know what? One of our board members, I'd like Bob to speak here because I'm really focusing on the community and the federally qualified health centers. Bob Hold'em, could you speak about that point? And he's from New York Presbyterian. He's part of their senior team.
Yeah, absolutely, Danielle. I mean, I think you're right. We have spent the last 6 months steeling ourselves for exactly what we're seeing now and are ready. I think the large health centers in New York are probably in a very similar place. What's not is a lot of the smaller community organizations, the ones that Afya helped in the spring, are back in the same place that they were in the spring again, unfortunately. And if you go across the US, there's a lot of places that did not do the level of preparation that they should. We unfortunately learned our lesson the first time and have done whatever we can to prepare, but there's a lot out there that's still lacking. And this is America, a first world country, no less. Yeah. The rest of the world that may need help as well. So, you know, thankful for what Afya has been able to do, and you know, I think for now we're in a good place, and I'm happy for that. But we are lucky in some ways.
I don't think so. I think just to piggyback off from Jake's question, Bob is representing the major, magnificent institutions of New York. We are going for the next rung, right? We are going for the federally qualified health centers and the community agencies who Westchester OEM, the Office of Emergency Management, asked us to take on the PPE needs for that segment of the healthcare population because they're going to be focusing on the hospitals and the nursing homes. So if we didn't say we're in, we'll assess, distribute, and serve that function, they would be in big trouble.
I want to say thank you so much to everybody for joining. You've all been so patient and so wonderful, great listeners. As always, you know exactly where to find us. You know where to find Afya. We're online, afyafoundation.org. Please go ahead and hit that donate button. We really rely on all of you and your support. And we'll see you on our social media. We'll see you on our emails. We'll see you online. Please, everybody, stay safe.
Thank you. Thank you all so much. Wishing everyone